is I'm gonna kind of just move on in my assessment. So I'm gonna have you sit right here and we're gonna look at your nares and paint, see, make sure they're painted.
Okay. You know, I had this surgery on, I had other surgeries besides just that one on my knee.
Okay, I'm sorry, I thought I already asked about all of them. So, what other surgeries did you have?
I've had 5 surgeries on my spine.
Okay.
I've had on my low back a lumbar laminectomy, a microdiscectomy, and a foraminotomy. Then wound up getting a fusion. Then I got a fusion in my neck. I've had this left rotator cuff repaired. I've had my right thumb reattached. I've had surgery for kidney stones.
Okay. Anything that's kind of what you're complaining about today?
No. No.
Okay.
And
But you're
my dad had a bunch of
Okay.
have a bunch of surgeries for his back and his joints and stuff too.
how's your mom's family history?
She's got thyroid issues. Yeah,
Okay,
she's still alive.
thyroid.
She's got thyroid issues, and then some kind of she's recently got diagnosed with skin cancer.
Okay.
Yeah.
Okay. And are you concerned about anything on your skin? Do you wear sunscreen? What kind of job do you do?
I'm a police officer.
Okay. Okay. So indoors most of the time until you have to go home. So do you have any issues with anxiety, depression, social factors? Feel safe at home?
Yeah, no, I feel safe at home. I'm very well armed.
Okay, perfect, perfect. And do you smoke, drink?
No.
No. No previous tobacco use or current tobacco
No.
use. And no illicit drug use. Is that
Correct.
okay? I'm gonna have you move over here and do my assessment on your nose, just to make sure that that flow nose is working okay. I'm gonna use the otoscope here. I'm gonna look in both nares. Okay. Both nares are patent, pink, moist, and dry, and there's no signs of a deviated septum. I know you said you've had some like neck surgeries. Is that right? Okay.
It's not bothering me though.
It's not bothering you at all. Okay, perfect. And then kind of moving on, I'm gonna listen to you. So your blood pressure is a little high.
That's high.
It's not my favorite. I like it to be a little bit lower, but since it's well managed, it seems like, and it seems like you're pretty consistent with your blood pressure
So
medicine.
you said, what should it be though? You said that you don't like it.
I kind of like it to be under 150 systolic if you're on well-managed blood pressure medicine, but it just kind of depends on your history. The perfect number for an average healthy person is 120/80.
Okay.
So we just want to keep all the pressure off of those cardiac muscles and save the kidneys as much as possible.
Got it. Okay.
All right, I'm going to listen to your heart here. All right, so I'm going to listen to the aortic, and then I'm going to listen to the pulmonic, and then I'm going to listen to the Erb's point, and then mitral, and then I'm going to listen to tricuspid. Everything sounds good. S1 and S2 are noted. There's no signs of murmurs or any palpitations, and on observation, there's no thrills or heaves. Okay? I'm going to assess your abdomen. Could you lay down for me?
Sure.
All right, hun. On inspection, I don't see any pulsations or any signs of, swelling or extended bowels of some sort. So I'm going to listen to your abdomen.
Wow, you have X-ray vision, huh?
Well, just making sure there's nothing bulging like a hernia or anything like that. I'm going to listen to your, in all 4 quadrants, okay? Okay, bowel sounds are normoactive. I'm gonna listen to the abdominal arteries. So I'm gonna palpate here. This is the aortic. This is the iliac. And then this is the femoral. And this is the renal. And it sounds good. I'm going to go ahead and palpate, and you just let me know if it hurts whenever I kind of push around, okay?
Yeah.
I'm gonna lightly.
Define sounds good.
There's good blood flow. There's no signs of delay. There's good pulsations in the. Sorry. Okay, I'm gonna lightly palpate. That feel okay?
Mm-hmm.
How about here? Okay, we'll come back to that. Okay.
Okay.
What about right here?
Fine.
No. Right here.
Fine.
Okay, I'm gonna dig a little bit deeper this time. Right here.
Fine.
Okay, I'm gonna go ahead and go right here. The McBurney's point is negative, and that was palpating the right lower quadrant. I'm gonna do something kind of strange with my hand and kind of go under your rib cage. I'm gonna have you inhale for me, and I'm gonna kind of push down really hard whenever you exhale.
Okay.
Ready? Go ahead and inhale for me. Okay, how does that feel? Okay.
That was awful.
Okay, the McBurney's point is positive, and I would be concerned a little bit about his gallbladder and kind of liver space. Any other pain here when I dig really deep?
No.
Okay, so while you're laying down, I'm gonna go ahead and assess this knee. I know you said your left knee was the issue, but are you still concerned about the right knee even though you had surgery on it?
No.
Okay, perfect. So I'm gonna do, I'm gonna have you sit up a little bit. If this bed raises, I'm gonna have it raise a little. Sorry. All right, I'm gonna do a test on your knee, and you just let me know if there's any pain.
Got it.
Okay. I'm gonna internally rotate your knee here. Any pain here?
No.
And that is the valgus test, and then I'm gonna do the external rotation here, and that's the valgus test. Any pain here? Okay. And any pain when you're walking?
No.
Okay. And I'm gonna have you put your knee kind of to your chest here, and I'm gonna internally rotate here. Is there any pain here?
No, not really.
Okay, and that's the interior jaw, and then I'm gonna do it here. Is there any pain here?
Not really.
Okay. Oh, sorry. That was not the anterior jaw. I correct myself. That was the McMurray's point. Miss McMurray. Sorry, there's a lot of M's and I get confused. All right, I'm gonna kind of sit on your foot real quick,
Okay.
and I'm going to push down it. Is there any pain there?
There's a little bit of pain kind of where your thumbs at over there.
Okay, and then I'm gonna pull back. Any pain there?
No.
Okay, perfect. And both of those, that was the anterior and posterior jaw. And then you said that you had any ankle pain or no? Okay, no ankle pain. I would be concerned a little bit about this meniscus too. Any trauma to it?
No.
Okay. Maybe we may consider getting some imaging on that.
Okay.
I don't really know how to do the Watchman's test. Is there any other concerns that you have today?
I mean, you had mentioned about like, you had talked about like anxiety,
Okay.
depression stuff.
Yeah.
Don't have any of that. I just, I can't sleep.
You just can't sleep.
I
Okay.
can't sleep.
Is it more frequent at night, or is it, or like, do you have trouble sleeping throughout the night, or falling asleep?
Both. Just can't sleep.
You just can't sleep. And how's your like dietary intake? Do you drink a lot of caffeine, energy drinks, coffee?
Yeah, I do drink coffee and occasional energy drinks, but Typically, I don't drink a lot of caffeine after 10 o'clock in the morning.
Okay, and you did do a sleep study.
Mhm.
Do you remember what happened, like the results of that? Besides, you sleep with
And they said I
non-
had sleep apnea, and they gave me this oral appliance to wear, and then
a CPAP.
no, it's it's like a big mouth guard type kind of thing.
Okay.
That kind of opens stuff up without having to. They said it wasn't severe enough that I didn't need a CPAP.
Okay.
Yeah.
And have you ever had like any tonsillar issues where
No.
you're like concerned with them swelling, kind of delaying, airway patency?
No.
Okay. Would you want to do like the sleep study again, or is there like a concern, like for medication? Is that kind of just trying to see what you
Just
are-
can't sleep.
just can't-
Don't like sleeping.
just don't like sleeping?
Yeah.
Okay. Are you rotating like between night shift and day shift since you're a police officer?
No.
Okay. And any vision problems or any hearing problems?
No.
Okay.
Sit up if that's okay.
No, that's fine. I was just. How long has the sleep been an issue?
About two and a half years now.
Okay. And have you seen anybody for it?
Yeah, the psych person that prescribed my Cymbalta.
Okay. And any is that not being effective? Is that kind of the other concern?
For what?
I know you said the Cymbalta you were more using for joint issues. Is
I
that?
just see that it helps more with that. I don't